Hi, my name's Abby. I'm here with nursing.com, and in this lesson, we'll discover the reason for drawing a beta-hydroxy lab. We'll talk about normal values and cases and conditions when we might see it increased or decreased. Let's get started. Beta-hydroxy butyrate, or abbreviated as BHB, measures and evaluates for ketoacidosis. BHBs are produced as a product of fatty acid metabolism, and 75% of all acids produced in ketosis are BHB. Now, it's synthesized in the liver and produced when glucose is low. This can happen in the times of prolonged exercise, starvation, and in the absence of dietary carbohydrates, because when all of these meat products are consumed, it's mostly a lot of fat, right? Tons of protein too, but that fatty acid metabolism is what puts us in ketosis. Some clinical indications for drawing this lab are to find out why a patient is in an acidotic state. So someone may show up with diabetic ketoacidosis or alcoholic ketoacidosis. It can also be drawn in the case of an increase in the anion gap, or with hyperinsulinic hypoglycemic state, HHS. We'll also see it drawn in controlled 24-hour fasts. Now, I included this insulin syringe because if there is insulin, what does it do? Insulin allows the glucose to go through the cell receptor on the cell wall, right? And so if there's insulin, then we shouldn't have ketosis. But if there's not insulin, like in the case of DKA, or when we have ketoacidosis, we know that it's fatty acids that are being produced, or ketones are actually being metabolized. Normal therapeutic values are below 0.4 millimoles per liter. Ketones, there's not a large abundance unless you're trying. Collection happens via a plasma separator tube, like this green top. Lab values will be increased with diabetic ketoacidosis, and it can be a result of any of those pre-meditating triggers. So this could be just, low intake of food. It could be, with diabetes, if there's no insulin, right, that sugar isn't able to get into the cell. So therefore, the body goes into ketoacidosis. It could be elevated during a time of the elevation in the anion gap, which means we have metabolic acidosis, or if someone's on the keto diet. HHS is in a time of insulin omission. So if the cells are so resistant to insulin, even in a non-type 1 diabetic state, we can see ketones being produced. Now, it's largely going to be evident when there's carbohydrate deprivation or deprivation of the sugars being able to get into the cell, like in the case of diabetes. Could be starvation, excessive vomiting, and digestive disturbances. We might also see ketosis with prolonged fasting or excessive alcohol consumption, like we talked about with alcoholic ketoacidosis. This value will be decreased in the correction of ketoacidosis. And these are the three really important pieces of correcting ketoacidosis. Of course, they're going to need insulin so that glucose can be driven into the cells. Fluids are super important in the treatment, right? Because that's going to help make the blood far less viscous and move things along. And then also when carbohydrates are introduced and metabolized, we're going to have a lack of ketone production. Now, our linchpins are that BHB, or beta-hydroxybutyrate, is produced in the absence of carbohydrate metabolism, and it's drawn to evaluate the etiology of that ketoacidotic state. Normal values are really low, below 0.4 millimoles per liter. An increased value especially if it's over 3 millimoles per liter, can indicate that we have a ketoacidotic state, whether that be from type 1 diabetes, alcoholic ketoacidosis, or if someone's really trying with the keto diet. Decreased value will be in the correction of ketoacidosis. Sometimes that's what we're looking for. That wraps it up on our lesson for BHBs. You all did great. Now go out, be your best self today, and as always, happy nursing.